You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Tennessee's go-to implant dentist. We have Dr. Sam Akhrass. Dr. Akhrass, welcome to the program.
Hey, Randy, how are you?
Good, good. Now, I know you brought a stack of photos, so we'll try to
Yes.
get to as many of those as possible. But for people that don't know your implant center, like who's the typical person coming in for dental implants?
Well, I don't have a typical patient. We definitely have, what I've noticed, two main categories of patients.
Okay.
The one type of patient is the people that have bad teeth, have always had, unfortunately, either gum disease, bad breath, teeth that are breaking down, just chipping teeth, just dental problems. And unfortunately, they're fighting a losing battle with their bad teeth. And what's really unfortunate for those patients, a lot of them feel like they're going to end up in a denture.
Okay.
And that's sad, but it's just not true anymore, because with dental implants, we can fix that. We can actually get them in implant-supported teeth, which basically means we can put 4 to 6 implants on the top jaw, 4 to 6 implants on the bottom jaw, and we can get them.
And they get a full arch of teeth.
They get a full arch of teeth, upper and lower, screwed into implants that do not come out.
Okay.
It's really comfortable. It's great. And the other set of patients that we typically have is patients already in dentures. Some of them have been wearing dentures 5, 10, up to even 30, 40 years. And they haven't been to the dentist in a while, and they don't know any better, and they think they're just stuck in a denture. But those type patients as well can come into my office, and within a single day after they give me the go-ahead to treat them, so we basically can then place implants in their bone, and they get teeth top and bottom that are attached to these implants, and they can chew and function and smile without having to worry about their teeth either moving or falling out or anything like that.
You know, in regard to denture wearers,
Yes.
And correct me if I'm wrong, that you say that on the day of the procedure, they can walk in with no upper and lower teeth and walk out with upper and lower teeth that don't come out.
That's true.
Is that rare?
No,
or?
we do it all the time.
Okay.
Yeah, we have lots of technology in our office. We have like facial scanners. We actually scan your face. And then we also have digital software. Nowadays with technology, it's just like everything in this world. You know, people have their latest iPhones, and there's so much technology even in cars and everything. Well, same thing with dentistry. And our industry is no different than any other industry. We also have all this technology, and we have it in our office because I want to give the best for my patients. So
Okay.
I've made sure to continue to learn, continually bring in the latest technologies into the office so I can then pass that on to my patients and give them great teeth. So getting back to your original question of if they come in the same day, we pull their teeth, or excuse me, in the denture where they've already had their teeth pulled, we plan everything in advance, so there's no guesswork. We know exactly where the implants need to go. We know exactly where the teeth need to go. For the high smile line, we know to hide what we call a transition line, which is where the teeth gums meet your regular gums. You don't want to show that because that would look fake. So we make sure to plan that with the high smile line to hide that. And so when we make the teeth, like I said, they go in, they're fixed in there, and they do not come out, and patients absolutely love how they can chew, eat, and function and be comfortable with their mouth again.
How soon can they eat after it's done?
Oh, they can eat pretty much right away. We recommend soft foods initially, just to take it easy. But before you know it, they're eating solid foods, and they're happy, and they can function and eat salads and eat the foods that they've missed.
I mean, they could eat whatever. Could you bite like a carrot with your front teeth?
No, you can bite whatever you want. Carrot. The only thing I joke with my patients, especially in the South, don't chew on ice. That's not good for anything.
Anything you can eat with regular teeth.
Anything you can eat with regular teeth, you can eat. You can have ribs, corn on the cob, salads, croutons, you name it, you can eat it.
So correct me if I'm wrong. The way dental implant dentistry is typically done in Tennessee, and I guess throughout the United States, is you go to one doctor that does the surgery.
Correct.
You go to another office that puts the teeth on top and then get them maintained elsewhere. At your office, I guess you do all 3 parts. Is that why you do it so quickly?
Yes, and I'm so glad you brought that up, because one of the things, not only we do it all in my office, but I get several sometimes consultations from people that have seen other doctors. And one of the number one reasons why they choose us, besides a good reputation that we have, is they like the fact that it all be done in one office. I'll hear over and over and over, patients will tell me, well, I don't have to go to this person and then this person and travel all around town. They love the fact that they can get it all done.
Because people
from
don't like going to the
start
dentist,
finish.
right?
Well, that's it, but it's also...
Do you ever hear that, by the way?
Oh, of course, I hear that all the time. No offense, Doc.
Do you secretly want to win them over?
Oh, I love winning people over, and I do it all the time.
Okay.
I have people that forget even implants. I have people that come in They're afraid of the dentist just for general dentistry stuff, and we win them over left and right, and they absolutely love now coming to the
Now, your wife works in the practice?
She
She's kind of
does.
the office manager? Is
She
that
does.
correct?
She does our advertising, social media. She also runs daily operations, and she's great. I love working with her.
I met her in the green room. She also has good teeth.
She has great teeth.
Did you have anything to do with that?
Yeah, we actually just recently finished up some Sure Smile on her and did some composite veneers and stuff that look really good, and she loves her new smile.
How old can you be? Like, what's the upper age range of somebody that could get dental implants?
That's a great question. There is no age limit. As long as you're healthy, medically healthy and stable, anybody can
What's
get
your oldest patient that had this done?
Just last week, I did 6 implants on an 88-year-old male.
Really? Why would an 88-year-old want to get this done?
Well, like I said, I just did it last week on an 8-year-old patient, and his number one reason, believe it or not, was just he misses eating salads. He's been wearing a denture, upper and lower denture, now for many years. He goes, "Doc, I cannot chew a salad, and I want to be able to chew salad again. I miss chewing salads." So now we put implants in, and now he's going to be able to enjoy eating salads again, and I'm excited for him.
You say they regret not doing it sooner.
Oh, that's the number one thing. And when I get done with patients that have done these procedures, I've never had anybody tell me I regret or I wish I hadn't done this, doc, or the number one thing they say is I wish I hadn't done it sooner. I hear that, left and right, over and over. I wish I'd done this sooner. And that's great to hear, because last thing you want to do is do all this work and somebody not be happy with the work, which that never happens, thankfully.
But it's true, though. I mean, if you've been wearing a denture like 10, 15 years, you're not able to do this because you don't have enough bone?
That's not completely true. Sometimes you hear that, but a lot of times with today's technology, we have advanced bone grafting techniques, and then we have specialized implants, like we just talked about, that can get bone in other areas that can then allow your teeth to go in your mouth and be attached to implants and not come out of your mouth. And you can chew and function just like me or you. I had a patient actually that, she's actually one of the patients I brought a picture of that we'll hopefully look at later. She was in a denture from teenage years, so like 30, 40 years, because I treated her about 2 years ago and she was in her 50s by the time I treated her, and she was wearing a denture for about 30, 40 years, like we talked about. And she was embarrassed, and this affected her social life too. She was embarrassed as a denture wearer, especially at a young age, I can't even imagine, to be able to go to a friend's house because she's not going to take her teeth out at night and put them in a cup with all these young... Yeah, so it affected her socially, so it was great that we were able to get her out of the denture, and she had we found bone, we got implants in, we actually put 7 implants in on her, so tell me she didn't have enough bone. We got 7 implants on her, and they're attached to the implants, and she's loving life and being able to chew and function.
So you see a lot of patients, before they do this procedure, are really worried about pain.
Yes.
Let's talk about that for a moment.
Yes. Well, patients are worried about pain. A lot of them, they're fearful. But really, we numb them up completely. You don't ever feel a thing. And they're sedated as well. Usually either oral or IV sedation.
All right.
And post-procedure, I of course see my patients for post-ops constantly, so I've seen them. I see how they're healing. And the number one complaint is it was a little sore for 24 hours, but usually most of them only take Tylenol or ibuprofen, so over-the-counter pain meds. And usually they tell me, believe it or not, doctor, after 24 hours, I felt great. So it's minimal and doesn't even last very long.
It's now, you brought some photos.
Yes.
So what are we looking at over here?
Well, this is a great one right here. This patient, her name is Laura. She was a very, very sweet lady. I love Laura. She's a very, very kind lady.
Okay.
And you can see that one of her laterals, they're sunk behind the central incisors, meaning the front 2 teeth. You can also see some missing teeth, and she looks really young there, even though she's in her 40s. She was just really, really self-conscious about her smile and her appearance. When I first met her, that's an exaggerated smile, and it took me about 10 minutes to convince her to give me that smile.
She didn't want to smile.
She did not want to smile. She had her hand over her mouth, and she was embarrassed about her smile, and it affected her confidence and her self-esteem without a doubt. And she had a bacterial infection, which was causing a bad taste in her mouth.
A gum disease. Is that what it's called?
Yeah, I mean, yeah, gum disease. And so what I liked about her is she mentioned to me, which I've heard this not just from her, from many of my patients that have severe bacterial infection disease in their mouth, they feel run down. People think this is why teeth are important.
Okay.
It's not like it's just the bacteria just stays in your mouth and it's right here and that's it. We have blood supply, every single one of us, or we wouldn't be alive. So the bacteria, it's going throughout your entire body.
Is that right?
And that's why she felt fatigued all the time. And I have many other patients that have told me the same thing. And it's amazing when you get the teeth out and you get the infection out, almost within the next day or two, they feel so much better. They have, not only they feel better, but they have more energy. That's another thing that I've heard. many of my patients tell me, doctor, now I can run around and keep up with my kids more, and I can do this.
That's very nice.
Yeah, they have more energy. And she actually lives about 80 miles from where I am. So she traveled to come see me, and I'm pretty sure she went and got a consult in her neighboring town, and which is the reason why she drove to me. They just wanted to basically take all her teeth out and put in her denture. And she's young. She didn't want to be a denture. She'd seen her grandparents.
You don't like dentures?
No, I don't like dentures at all. If upper denture, you cover the palate, you lose taste, and many other negative. You could cause sore spots, movement. You can't chew or function. Nowhere near there's like 5% chewing efficiency according to the American Dental Association for denture wearers compared to me or you that can chew and bite any food we want at 100%. Okay. So that's a big difference.
So what did you do for her?
For her, we basically cleared up all the infection by pulling all the upper teeth.
Okay.
And we placed 5 dental implants on the top, and we placed, I believe it was 5 dental implants on the bottom as well. And we basically made teeth that same day, we 3D printed teeth that went in. We call them healing teeth, but they're teeth. And she wore those for about 4 months, and then we came back later and made her final teeth that she absolutely loves.
Let's take a look. Is that her over there?
Yeah, look at this.
Oh, wow. She looks different.
Yeah, I mean, you can definitely tell she looks a lot happier. She's got a big smile. She's much more confident in that smile. One of the best compliments I've gotten, thankfully, a lot of good compliments from my patients from the work we do. One of the best compliments I've ever gotten literally is from Laura. That's why one of the reasons why I think I love Laura so much. She told me and my wife over and over that the only pain she has is from smiling constantly, that my cheeks hurt from smiling all the time. Now that's a good compliment.
That's what she said.
That's what she said. She goes, literally, my cheeks up here, doctor, hurt from smiling all the time.
Well, what's it like when they look at the mirror? In the mirror for the first time?
First time she looked in the mirror, she started crying. She said, Dr. Akhrass, you've given me my life back. She was doing this and looking at him and feeling him and said...
Are they surprised?
Oh yeah, she was shocked that they could look that good. She kept saying over and over, these feel real, these feel like mine, these feel light, they feel natural. She said like maybe 5, 6 times, these feel so natural, Dr. Akhrass. And I'm just... Oh, she just loved them, and she turned around and gave me a big hug, and I think we both were crying. I'd like to show you this patient as well. It's another one I like a lot. Her name is Mary. When she first met me, she actually came to me she moved from Chicago. She moved to 20 miles away from where my office is, and she was at first actually contemplating traveling to Chicago to see a fellow diplomate of the American Board of Oral Implantology, dentist. But she realized that was going to be difficult to travel back and forth. So she asked for a recommendation, and that's how she found me. She found me on their website, of the ABOI website. And some of her problems she had some bacterial infection. She was fighting a losing battle. She'd been going to the periodontist for years, trying to save her teeth, having gum surgery and all these things, and she still was losing bone, losing her teeth, and had bad breath, and she was just tired of losing this battle. So she came to me.
Because she didn't want a denture.
She did not want a denture. Okay. Exactly. That was her motivation to find me. She did not want to be in a denture. She knew that. She knew all the negatives about a denture. She was a very educated patient. And she wanted to get implants and teeth that don't come in and out of her mouth. She wanted to be confident.
Okay.
And if you notice, her eyes are closed.
Yeah.
And what I've seen that a lot in patients, when their eyes are closed, they're self-conscious about their smile. And a smile is so important. I'm not just saying this as a dentist.
Doesn't surprise me that you think the smile is the most important thing.
I'm sure you would think, but honestly, I'm not just saying this as a dentist. There's many studies that have shown and proven that a smile, for example, is one of the top 3 things that most people look at when they're, and also even like in job interviews. If you have 2 people that are almost identical candidates, the people that smile more are usually going to get the job more than somebody that doesn't. So smiling is very important. For life, I feel like when you have a great smile, you exude confidence, and I've seen that in my own patients, so it's not like just take my word for it.
You say they transform.
Oh,
like they come in one way,
they absolutely, and here's the example. When you see the final on her, You'll see what I'm talking about. Her eyes are closed here. It was difficult to get that smile. Now look at this. I think this says it all. What do you think?
Very nice.
Yeah, see the eyes are open wide. You see her pupils. You see a big smile. She's got makeup on. She's fixed her hair.
And you say the smile gets bigger over time.
Oh, it gets bigger over time. Oh, well, at first you got to get used to them. So you're used to not smiling. So at first you're going to smile and you're kind of reluctant. You're not sure if you really believe in that smile, but then the more you get out there, the more you get compliments about your smile. I have patients that are like, oh, I get 10, 12 compliments a day sometimes of how great my smile looks. And I tell them, you need to go see Dr. Akhrass because he can make you look this good.
Now, they look real. And I want to back up for a moment. You actually print the teeth in the next room.
Yes.
Is that
that's
right?
the surgery teeth.
And then you plan the surgery on a computer.
Correct.
Did they ever get to see what their teeth are going to look like?
If they want to. And if they want to, some patients don't want to be that involved in the process. Okay. If they want to, sure, we let them see. We can design them on a computer. They can see before, and we also have a facial scanner, which is great. What that basically does is it takes pictures of your entire face that then we can upload in the computer. So we can build that smile with your face on a computer. It's really, really neat technology.
You told me in the green room, I mean, without the technology, you couldn't get the smiles to look this good in this short a period of time.
Correct. In that short period of time. We could get it to still look good, but it would take like 6 to 12 visits. You know, it would take multiple visits, where with all the technology we have now, we've gotten it down to 2 to 3 visits.
Done quickly.
Oh yeah, very, very fast now.
Very nice. Yeah. And you said patients will sometimes say, you've changed their life.
Yeah, they do say that, but it's really, I play a small part in it. They're the ones that changed their lives because they're the ones that took the action. They're the ones that came to the office. They're the ones that...
That's the hard part.
That's the hard part. It's just coming into the office, taking that first step, you know, picking up that phone and saying, I want to do something about this problem I have. So I commend all of these patients that have taken the time to change their own lives, and I'm glad I could play a small part in it.
You know, we talked about this in the green room too, where you're on a consult, and I'm going to paraphrase slightly, but they're telling you their hard luck story, and they've said they're going to move forward with it. But it's like they don't even know how good this is going to be. That you feel that way.
Yes.
Is that true?
That is so true, and I'm glad you brought that up because, you know, I do a lot of these procedures, so I see the before and afters and see the transformations. Where somebody coming in having this done, they don't know, so they can't appreciate the amount of function that they're going to have. They can't appreciate how great
function meaning they can eat whatever they want.
They can eat and chew whatever they want. They can't appreciate how good their smile is going to look and the confidence that that's going to bring back to them. Like you see here with this picture, you know, the closed eyes to the big open eyes, and so we see that all the time. All right, let me show you this next patient. Here you go.
All right.
Okay, this is Robert. He came in, he wants to retire and he wants to travel a lot, and as you can see, he's missing some teeth and he had some other teeth breaking down, falling apart on him. He's like, Doc, I don't want to be traveling and have a tooth fall out of my head. I want to be able to have implant-supported teeth that I know I can trust. I know I can chew whatever I want. I know I can go anywhere in the world and not have to worry about having a toothache or teeth problems. So we want to give him upper and lower teeth with implants that do not come out.
His option would have been a denture.
Yes.
I mean, pretty much everybody that you're showing me could have ended up in a denture.
Correct. Every single person could have.
At the top of the show, I said, no more dentures. Do you think that's the future of dentistry? Like dentures as we know them today, whether it's 50 years or whatever, nobody will be wearing, that all dentures will be attached to something.
Absolutely.
Do you think that's?
Absolutely. I think that's the future, and that's the way it needs to be because we have the technology. Why should we not have the best for our patients?
Okay, good. I interrupted you. So this patient comes in. His option was a denture. What did you do?
His option was a denture, and we ended up placing implants and attaching them. And now he has teeth that don't come out, and they're he's super happy.
Is that him right there?
He's
looking good.
Yeah. Doesn't he look happy on that note? That's great timing.
Very nice.
Great timing. Yeah. So you can tell he's smiling from ear to ear.
He looks younger.
He does. He looks younger. He looks sophisticated. He looks happy.
I'm not trying to side with you either. You know, people just tuning in. I'm just asking the questions.
Yeah.
Because you were saying, oh, it changes their appearance. It makes them look better and younger. But it's true. I think anybody looking at this.
Pictures don't lie. I mean, clearly you can see that, and you can see.
What does a guy like this say when it's all done?
He says, I can chew and eat whatever I want. The teeth, they feel solid. I'm confident. I'm happy. I'm glad we did this.
Now, people that are over 70 statistically are on 3 or 4 medications. Can people be on medications like type 2 diabetes medications or even blood pressure medications and still do this?
Absolutely. I have patients on blood thinners that say, well, you sure we can do this? Is it safe? And we say yes. Most of the time, especially if they're only on one blood thinner, most of the time I don't even have them stop the blood thinner so that we don't risk a stroke or anything. So we keep them on their blood thinners.
Do you ever have to get their medical doctor involved?
If there's multiple blood thinners, I'll get a medical doctor involved. Absolutely. Yes. Because then I'll need to stop at least 1 or 2 of them. And we want the medical doctor to make that decision since they're the one prescribing the medication. Typically, if they're just on one blood thinner, I haven't had an issue for that.
Now, a guy like this, and on his before, you say people hold on to their teeth too long. Like he went a long time. You said in general, people hold on to their teeth too long. When this is all done, is this one of those things where he says, man, I should have done this a long time ago?
Every single patient I've ever done one of these procedures on tells
do.
me that. So man, my only regret is I didn't do it any sooner. This patient here, her name is Deborah. This is the one I was actually telling you about earlier that lost her teeth in a car wreck as an adolescent.
So is that a denture that she's
That
wearing?
is a denture she's wearing, absolutely, yes. And so she came to me, she'd been no teeth on the top for 30, 40 years by the time I met her. She thought she didn't have bone. We did an exam. She had plenty of bone. We placed several implants and we attached the teeth to the implants, and now she can chew and function and she's happy. Okay, so I'd like to show you her after pictures
right,
so you
let's
can
take a
see what I'm talking about. Here you go.
Oh, wow.
So as you can see, she's definitely more confident. She's smiling bigger. She looks younger in that picture too, I believe.
Yeah.
Yeah, she definitely looks younger, and she's just been so happy.
How many years was she wearing a denture?
Almost 40 years.
So it's really not too late.
No,
somebody.
I mean, I've had people 40 years and they've been wearing a denture, and we can do. I've had patients 80s, 90s. I mean, you name it. You're not too old, and it's not too late.
Now, so when a 70-year-old comes to you and says, Doc, I'm too old for this,
I hear it all the
close?
time. I hear it all the time, and it's not even close. You know what I tell them? I said, nowadays people are living into their 90s. So even if you live 20 more years, wouldn't you want to do this procedure and have teeth that you can chew with, eat whatever you want, smile with confidence for the next 20 years? Isn't that worth it? I mean, to me, I would say yes, anytime.
We're low on time, but so I'll rush you through the rest of these photos.
Okay. Here, this guy, his name is Chris.
All right.
He actually had failing teeth. He had severe bacterial infection with his teeth. They were super loose, like that front tooth. He was afraid it was going to come out just when we were scanning his teeth. Like that's how loose it was.
Now, when you have this gum disease, let me ask you this question. Aren't your gums too bad to do this? I mean, will they support the implants?
No, the gums are not too bad. It's all based off the bone, and even though you probably have a little bit of bone loss, there's usually plenty of bone left to still get implants.
So it doesn't matter how bad your gums were?
It doesn't matter how gums are.
Statistically,
we remove everything, we clean everything up, so you're a clean slate, and you can definitely get implants in no matter how bad your gums are.
Okay, so his teeth had to come out.
His teeth had to come out, and he would have been stuck in a denture, and he's like 40-something years old. Who wants to be in a denture at 40-something years old? That's a long time to wear a denture. So we got him all fixed up, and he wanted really pretty white teeth, and look at that nice result.
He's looking good.
Yeah, he is just super happy, smiling from ear to ear, just really enjoying to be able to, like he said, I love to eat apples and bite into apples, and he can do that now with those teeth. I'd like to also show you this patient right here. Her name is Missy. She had a bad car wreck when she was a little bit younger.
Those
so
teeth
that's
are pretty
actually, they're not bad, but that's a partial. So those are teeth that come in and out.
So she take them out all the time?
Yeah, and she was self-conscious about that. She goes, I don't want to be in teeth that come in and out. I want to be able to have my own teeth. They're in my mouth. I don't have to worry about. So, of course, we got her all finished up, and that's her final appearance, and you can tell she's
nice.
just a nice smile there, and is just happy with her new teeth, and she can eat and chew anything she wants as well. Now, Randy, I want you to take a close look at this after. See how her canines are pointy? That's by design.
Okay.
The front teeth have a little bit of curvature to it, as natural teeth should. Right along the edges are rounded in appearance, which she liked, is very feminine. So
this wouldn't work for a guy?
No. That's what you read my mind. I was about to say, these are custom made for a female at her age, and she absolutely loved the shape of the teeth that we did for her.
How much is art? How much is science, in your opinion, as far as creating this whole thing?
That's a great question. My patients tell me all the time, it's like, you're not only a doctor, you're an artist too. And I don't know to put a percentage to it, but it definitely involves both.
Now, back to your training for a moment. I mean, you are an examiner. I mean, you judge other doctors' work that are breaking into or learning implant dentistry.
Yes, at the American Academy of Implant Dentistry, I've done it for the last 2 years. Been an examiner for them. Also, and then also I do a lot of continuing education as well.
In fact, did you have the most continuing education of any dentist in your state?
I did. I won that. It's called the ACE Award in Tennessee. I won that award a few years back.
Is there that much to this? Respectfully, I say this.
Well, to be great at it, I believe there is a lot to it, yes, because there's so many little things that you need to know to do it right. Now, not anybody, any dentist could do it, but is it going to be done right? Is it going to stand the test of time? Now, if you want to have that done, then you really need to find somebody that really knows what they're doing so that it lasts many, many years to
Do you have a bit of a bias? Because I know, and you mentioned, you have great oral surgeons, periodontists, specialists in your area. But do you have a bias that they should have a diplomate status where they've taken these
Obviously, I'm going to be a little bit biased since I have that credential, but oral surgeons can do a great job. But unfortunately, I have an unfair advantage that I can do all their teeth and do everything in-house and take care of all their needs all in my practice.
Because the oral surgeon doesn't make the teeth part like you do.
Typically not, no.
So that's why you do it faster.
Correct, and we can do it faster because we do it all in one place.
We're short on time.
Okay.
So if a patient goes to you, of the two categories, one has really, really bad teeth and gums. It's been determined they have to be removed, or they're wearing a denture. What are their options when it comes to dental implants in your practice?
Oh, with dental implants, at a minimum on the lower jaw, you want to have 2 implants put here in the front so they can have a denture that snaps in, snap out. Now, you know, that's better than a basic denture, I'll admit to that, but it's really not ideal. I'd much rather have several implants, teeth that are screwed in, teeth that are attached that don't come out. The negative to that is still a denture, it's still bulky, it still can move in the back. They still a lot of times have to wear adhesive to fix them in the back because 2 implants over here is not going to allow this to not move. This is going to have some movement back here. So it's definitely better than a basic denture, but it's the next step up, but it's still
so
not
ideally,
that great.
People want teeth that don't come out.
Yeah, people want teeth that don't come out. They're not happy with teeth come out. So the next level is 4 implants, but once again, snap in, snap out. You know, a lot of times we recommend to still have the palate for that. So if you have the palate, that means the denture is still full denture that covers your palate. That covers up the taste buds that you have up there. And people can't enjoy wine if you enjoy wine or certain spicy foods. You just can't enjoy them.
Okay, so hot and cold, you can't
even
feel
my
it.
wife told me not too long ago that she didn't even realize that. And I was like, I don't know how I hadn't told her that after all these years of being married and being a dentist. But she didn't realize that we had taste buds on our palate, which we do. So that helps by having the kind of implants and the kind of teeth that are attached to implants that don't come out of your mouth. Now that's an arch shape of teeth, so therefore your palate is not covered. You can fully enjoy your food and you can taste everything.
Now I know a couple of denture wearers. They never complain.
That's because they're not going to complain to you, Randy.
Okay, good.
They don't want to act, and probably a lot of, I mean, you might know, a lot of denture wearers, they also don't want to admit that they're in a denture. You know, in your case, they knew that, but most people, they're embarrassed about being in a denture, so they don't want to admit that to you. So that's probably also why you're not hearing many denture wearers complaining. But I see them, and they come to me, and they hate them, and they're happy and excited to be able to, for me to offer this for them and get them out of those dentures that they can't
Very
stand.
nice. Now we have to bring this up. I guess even the best dental insurance doesn't cover implant dentistry. Medicare, Medicaid doesn't cover it really at all.
That's true.
But you say people are financing this.
Yes, and we have actually partnered with like 5 or 6 companies in our office, so that's actually made to finance dental procedures like this.
You have to have okay credit.
You do have to have okay credit, and of course you can also take, finance it up different ways, but we do have finance companies that we are partners with in my office that can help you get you financed to help pay for these procedures because,
So no more dentures.
No more dentures. That's what we want.
Good. Final message.
Yes.
Let's say people are watching this. They're of the 2 categories, a denture or really bad teeth. They've heard what you have to say, but they're still scared or skeptical. What do you say to them?
I say give us a call.
Okay.
Come meet our team, and we will reassure you of any fears or any apprehensions you have. I've never had a patient leave my office that wasn't happy with the final result, and never ever. The only statement I ever get is, I wish I'd done it sooner. Okay, great. I want to thank you for coming on the show. Also, if they want to make an appointment, do they go to the website or just call your office? What do you prefer? We prefer they call out the office, but of course you can also go to the website and do that as well, whichever they prefer. But we prefer if you just give us a call. All right. Thanks again. Good stuff. Thank you. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.